This is going to be the announcement for the first grant recipients of the Ohio State University Opioid Innovation Fund.
This was exactly what I was hoping, was to come here and to meet with a variety of researchers who are looking from many different perspectives at this national crisis, which has Ohio as sort of ground zero. And so I learned a lot about the research that's going on here and the ways in which these various projects are linked together, but trying to link together even further. And of course it was a pleasure and a privilege to be here as these 8 new projects were announced in terms of funding that have gone through an extensive peer review process and will further add to the research strength of OSU.
To address the opioid crisis is very complex, that working together is the only option.
What the project is doing is the funds are going to be used to develop a web-based geospatial analytics platform that will be more than just a dashboard. It will be a way to address policy questions and research questions and provide data that Columbus Public Health or the City of Columbus or other agencies are able to use right away to make better decisions, to make faster decisions, and to save more lives.
Dr. JaNelle Ricks and Dr. Kathy Lancaster from the College of Public Health.
So we partnered with Equitas Health and Paul Wirth and Associates here in Columbus to put together a community-based campaign to promote the use of naloxone for opioid overdose reversal and to also reduce the stigma in the community around that particular issue.
Dr. Cecilia Mengo from the College of Social Work. The exciting part for me personally is that disciplines are coming together who have never worked together, because they recognize the problem is complex and it takes a team of people willing to share. And that doesn't always happen naturally in academia, but in this particular case, it has happened. So it is gratifying, it is a process, and I feel like we're just, if this is a Kentucky Derby, we haven't even passed the quarter pole, but it is something where I can at least begin to see there's a way Ohio State is going to make all the connections needed down at the community level, and I think and as far away as DC with our federal agencies.
I think it's tremendous that Ohio State has made this commitment to the community in which many of the overdoses are occurring. I think that as a land-grant university, showing that commitment to the community where we are working and living and existing is just incredible.